Okay. So hello, my name is Brittany Hinkle, and I am a fourth year doctoral student in the counseling psychology program at Howard University. I am a behavior health ambassador for the HBCU C.A.R.E.S initiative on the campus of Clarke Atlanta University. Today, I have with me Dr. Christina Clarke, a counseling psychologist. So, Dr. Clarke, can you tell us a little bit about yourself and what you do in the behavioral health field?
Sure. I'm a licensed psychologist in the state of Georgia, and I work in a academic medical home at Emory University as an assistant professor. And what that's comprised of is seeing patients, doing both individual, couples, and group therapy. And then I also supervise med students and psychology doc students as well, and do some research. So it's a nice little integration of different things.
Yeah. So now how exactly did you get to work for a school of medicine?
Great question. So it's funny, I don't know if that was my plan, to be quite frank, during my doc program. I thought that I might want to work in academia, but not necessarily within a school of medicine. But I do also love being a clinician, so it's ideal for me, to be quite frank. And what happened is I went to internship, and then for my postdoc, I applied to Emory. Because the position looked like a good fit in terms of the clinical opportunities and the trainings provided. And it was a APA accredited postdoc site, although it doesn't have to be APA accredited for postdoc, to be quite frank. But I like the ease of transitioning from an APA accredited internship into a postdoc, so that was a draw for me as well. And I got the position, and so I thrived in that. And then the pandemic hit halfway through my first year of postdoc, and I ended up staying a second year, which on postdoc at Emory, which worked out because then a lot of the positions they were hiring for, they hired more so when I was getting ready to finish my postdoc. It also gave me more time to build relationships, get out a publication. And so all of that prepared me for that position. And it gave me insight to say, hey, this is where I want to be, right? Having that experience, the postdoc experience, it was ideal in terms of giving me a really good sense of if I thought that I could fit well in that system, and it was an ideal fit. And so I'm super glad to be where I am in my career right now.
Yeah, that is so cool. I know for myself, I didn't know that at first that psychologists could work in a school of medicine. So it is definitely just broadened my horizons to all the places and settings where psychologists can work. So what is the most rewarding thing about your job?
That's hard to say because it makes it as if there's just one thing, and that's part of why I'm in the position, because there are a multitude of things that really um, satisfy me in the work that I do. So I've always known that naturally I thrive as a clinician. I love being a therapist and helping people to grow. A lot of times when we touch on key things during session and healing is facilitated, you can feel it. And I get to be a part of that journey and a part of that process. And I oftentimes walk out of those sessions, or log out of those sessions these days, feeling energized. So it's exciting for me to help with that. But also, I think that with anything, if you do the same thing all day, every day, you'll get burned out or tired. So I do like doing other things. I love supervising. You yourself, Brittany, know that I really enjoy mentoring and supervising. We've worked together in different capacities where you receive my guidance in a professional way in both research, more so research, really. And so I think you can tell I have a passion for that in terms of thinking through what's the best way to help you to understand this, make the most of this experience, and make it your own, right? And so that it can benefit your career. So I love planting those seeds just to see people grow professionally, and especially other women, right? Excelling in our career goals. It's really exciting for me. So those pieces, and then I do actually love research as well. I'm not as advanced in my research career as I am in my clinical and supervisory experience. I've got a publication or two out. And so I'm working on doing more of those right now. But I do especially love qualitative research, although I think I love any research that conveys meaningful data that's going to just improve the quality of the work that we as psychologists provide. That excites me. So yeah, I don't think it's just one thing. And I do like that as a psychologist, I have the opportunity to dive into these different areas. And these are like big ticket items, right? Within our
Mm-hmm.
profession, but there are a lot of other ways that we can use our career. I'm getting my feet wet with consultation and workshops and things of that nature. So there's just so much we can find that calls technology. So um and I like that. I love that our career offers us the opportunity to constantly diversify and evolve what we're doing as psychologists.
Mm-hmm. Yeah, I definitely hear what you're speaking to because I know that that has been an interest of mine is just having flexibility within the career. So if there was like the most rewarding thing, it sounds like it's having the ability to be flexible and do all of these things, which is really cool about, being a psychologist. So why did you choose your particular career path?
Yeah, great question. And actually, I just want to briefly circle back around even to the
Mhm.
last question about what excites me. I also want to name also that even clinically, we get a chance to diversify that. Like I've done individual for so long, and group is like something that I haven't done it as long as individual, but still for a good bit of time. But I've added couples work, and so
Mhm.
that's been exciting to really cultivate that skill set, and it engages me in a way that the clinical work that I've been doing for a longer period of time doesn't, just because it's new. But then to your question about why did I get in the field to help people? I know that sounds super basic, but it's true. I actually lived in Japan for a few years after undergrad, and I remember thinking you cannot come back unless you have a plan. Because I went straight out of undergrad into a program where I was teaching English to Japanese high school students, and I went there to have that time abroad and to also figure out what my next steps were. I had a clear sense that I was probably going to be going to grad school, but wanted to clarify what for and what would be the passion. I kind of broadly understood that maybe I'd want to be a professor and in academia at that time also,
Mhm.
but just didn't know what field, which is an interesting thing to look back on it now. But I just honestly spent a lot of time in Japan just reflecting. There was a lot of solitude, a lot of time for introspection, journaling, taking online quizzes, and talking with my friends. And the one thing that honestly stood out to me is that I would never be able to show up to the same position or role or career every day if it was just to push numbers or to figure out a bottom line. I knew that helping people would be what would motivate me and engage me. That was pivotal. And honestly, once I started researching different tracks and I found counseling psychology, I knew that was for me. And I started looking at programs and looking at coursework. And I remember just thinking every course that I saw offered in the catalog for the master's in counseling and then the PhD in counseling psych, I was like, "Ooh, I want to take that. I want to take that. I want to take that."
Mhm.
And I had never really felt that way about school before, to be honest. Like I'd always been like, "This is what I'm doing to like build a life for myself." But that was the first time I felt excited about my career in education. And to be honest, I've never looked back. I've never once doubted that this is the path for me career wise, personally.
Yeah, yeah. That's so good to hear. So what advice would you give someone aspiring to work in your field or another behavior health field?
Once again, I don't, you know, I think it's about introspection and what fits you, right? So my journey might not be someone else's, but also there's more than one way to pursue this path, or more than one way to utilize the training, right? So I don't do a ton of assessment, but assessment is a cornerstone of the psychologist's identity, right? So there are some psychologists that love it, and that's what they do. So just really investigating, researching what the professional identity of psychologists is comprised of, um, looking and researching and researching what that looks like in application, maybe shadowing, continuing to have conversations with someone like me, and also someone like you, Brittany, where you are in your professional development, because you're still at the advanced stages of your doctorate degree, you're
Mhm.
going on an internship. So you have you're in it right now. You have a great sense of what the training looks like. And, that's a pivotal time. So talking to people in different phases of their career, reading about it and looking within, right? I think looking within is huge, and being real about what draws you. Because I think that in that time when I was in Japan, I also had to differentiate what looked good in my mind versus what actually fit me. And I
Mhm.
think for me, those were two different things. Some other people may be more aligned than myself, but I would just say research, talk to folks, and look within and figure out what's the best fit for you. Yeah.
Yeah. Is there anything else that you want to share with us today or let us know about the field of psychology or yourself?
Mm, I mean, I do love helping people, and I think that it's a growing field, and more
Mhm.
than one way to use it, and to develop a career around it. And so, um, yeah, for myself, um, not that I can think of, no.
Okay. Well, thank you so much for your time today and sharing your knowledge about psychology and all the things that you can do within the field. It's so exciting. I'm so happy that I also know you on a personal level as a mentor. And I have, of course, I'm glad that you were able to participate in this interview today. So thank you.
Oh, I did think of something. I know you just wrapped it all up.
Go ahead.
I would say building relationships is really important. I know that it sounded very serendipitous how I ended up as a professor at Emory in the School of Medicine, but part of that was building relationships and being willing to go the extra mile in a lot of the work that I did. But I was able to also go that extra mile because I always pick things that fit my passion and not just what look good on paper. That's
Mhm.
pivotal. So like there are key points where, for example, with my dissertation could have been all about trauma, which as a clinician I do a lot of work in trauma, and that makes sense. But research, what drew me was emotional intimacy in couples, and that was a radical shift. So sorry, I just thought about that, and I just want to name that. For me, I picked my passion to draw me forward, and each time that also aided in my ability to build solid relationships because people knew I was coming from an authentic place, and I knew I was coming from an authentic place. And my work was always, the best I had to offer because of that as well. And so people will talk about publications, and you need to have those and all of that, but you also need to have the relationships and then
Mhm.
genuine interest in what you're doing. And the more you can align those two, the better off you are.
Yeah,
So,
well, I mean, relationships are a big deal. I mean, it's a large part of the reason I have you here participating in this interview. And I don't take that lightly. I'm fortunate that you were able to interview with me today.
I'm
So,
glad to.
well, thank you, Dr. Clarke, and I will talk to you soon.
Okay, talk to you soon. Thanks.